Hello, my name is Rebecca Pruveadenti, and I'm the president of the Northwest chapter of Healthcare for All PA. I'd like to thank you in advance for watching this video. Healthcare for All PA is a statewide, grassroots, nonpartisan group who believes that a single-payer healthcare delivery system is viable in Pennsylvania. Our organization is comprised of former Democratic and Republican legislators, physicians, nurses, business owners, and other individuals from across the state who completely support the initiative of a single-payer healthcare system. We feel so strongly about single-payer, we commissioned an economic impact study. The study was released March 5th of this year and confirms what we knew all along, that the current employer-based health insurance model is unsustainable. It does not control costs and leaves many Pennsylvania residents without access to affordable health care. First, I'd like to talk about the term single payer. You may have heard other names like one payer, universal care, or Medicare for all. Throughout this video, I will use the term single payer, which really refers to the way that we would finance or pay for single-payer healthcare system, similar to what other countries have achieved. The first question is always, how much will it cost? Instead of paying health insurance premiums to health insurance companies, our plan calls for a 10% payroll tax on business and 3% tax on individual income. The 10% and 3% taxes go to a managed pool instead of to health insurance companies. The money comes out of the managed pool to pay all health care providers directly for actual health care received by the individual. No middlemen are needed. Individuals would pay 3% on earned income. For example, a worker making $20,000 a year would pay $600 a year. That $600 covers doctor visits, hospital stays, mental health care, prescriptions, dental visits, and more. That $600 a year guarantees no copays and no other out-of-pocket expenses. That $600 a year protects you from medical bankruptcy in case of catastrophic illness or injury. And that $600 a year covers you if you travel and have a medical event outside of the state of Pennsylvania. Many of you will want to know how this plan affects you if you're a stay-at-home mom, retired, on Medicare, or receiving state or federal benefits. Time in this video does not allow us to cover all of the different scenarios and answer your questions, but the study does address all of those issues. We invite you to go to the website at www.healthcareforallpa.org and download a copy of our EIS or check our FAQs. I want to be very clear about what I'm about to say next. In order for Pennsylvania residents to have a single-payer health care system, we must completely replace the current for-profit health insurance model. This current model allows for the health insurance industry to make obscene profits by first taking money from all sides, and by secondly, restricting our freedom to choose our health care options. The current for-profit health insurance model is directly responsible for 50% of all bankruptcies in the United States. The single-payer healthcare system has its opponents. Single-payer opponents persistently repeat misinformation and say that a single-payer healthcare system is not possible, not affordable. Who would spread misinformation about a comprehensive health care plan that would benefit every Pennsylvania resident, business, school district, and municipality? Who are the opponents of a single-payer health care system? The health insurance industry, Big Pharma, and their 7 lobbyists per representatives in Congress. For business owners, money spent on health insurance premiums, which pay for health insurance advertising and health insurance CEO salaries, is money not spent on business growth, job creation, or actual health care. For individuals, money spent on health insurance premiums, which pay for health insurance advertising and CEO salaries, is money not spent on food, clothing, housing, and all other life essentials. Instead of paying for health insurance premiums, why don't we just pay for a single-payer system? Our single-payer plan is publicly funded. Publicly funded means that everyone would pay their fair share and the money goes into a pool. The pool of money is managed by the government or a government-sanctioned agency. Our single-payer plan is privately delivered, which means Pennsylvania residents will have the freedom to choose their doctors and hospitals. The plan is designed to pay for all medically necessary care, including hospital care, doctor visits, nurses' visits, mental health care, dental care, occupational and physical therapy, prescription drugs, medical devices, medically necessary nursing home care, and home health care. Our single-payer plan is cost-effective. There's no profit margin for the managing agency. They simply get their administrative costs covered, and our study shows that the cost for management of the pool of money will be low, as low in the case of Medicare, which runs about 2 to 3%. Single-payer health care will not be free, but it doesn't have to cost an arm and a leg. There are many other advantages to single-payer health care plan, and not enough time in this video to discuss them all, but I offer you these 4 benefits for starters. With our single-payer plan, individuals and businesses benefit because each year they will have clear and identifiable costs for budgeting purposes. Single-payer allows business owners equal ability to compete for employees in the job market, which is good for business and good for job seekers. And eligibility is determined simply by having a primary residence in Pennsylvania and by filing a Pennsylvania income tax. I hope this video was helpful and you have a better understanding of what a single-payer care system is and how many benefits it can provide for the residents of Pennsylvania. Visit our website and join us in our efforts to build a better, more equal, and accessible system of healthcare delivery in Pennsylvania. I'll close with the central question that our organization asked of ourselves. Who is not deserving of affordable health care? Is it you? Thank you.